Okay, I think we should get started. And I'd first like all of you to be here, both the audience and the speakers, in Collège de France, which has this tradition of free teaching and timely exposure of timely scientific topics. And I think we really are, with respect to differentiation therapy, to a turning point, and I think this will become clear and as the day progresses, as models are getting extended to new themes. So I have to convey the apologies of Pier Paolo Pandolfi, who told me 2 days ago or 3 days ago that he would not be able to come due to family issues. So I've changed the program, and I've decided to try to make up for Pier Paolo, which of course is hard. Quite a challenge on me today to entertain you the way he does. Really what we're reviewing and celebrating today is this concept that the phenotype of malignant cells can be actually changed by external agents, which led to this concept of differentiation therapy. And I think it's very timely because, as we'll review extensively today, differentiation therapy for many years was synonymous with acute promyelocytic leukemia, on which fantastic both clinical and mechanistic progress were made to the point where today we can almost cure every patient, and moreover we know what we're doing at the molecular level. We know exactly which are the pathways being activated and what are the mechanisms involved in this cure, which is actually quite unique for human cancers. And for a long time, acute promyelocytic leukemia was really considered as a miracle and hence an exception. And I think in the past couple of years, and work including from many of the speakers here, has shown that maybe this miracle is no longer an isolation, but may become a model. And what has been achieved for APL could progressively be extended to other systems. So just in word of introduction, I think the first, and I know that Laurent de Gauss will extensively review these historical aspects. I think really everything started with Leo Sachs and this seminal paper almost 50 years ago, in which he showed that some substances not identified at the time, which turned out to be growth factors, hematopoietic growth factors, could change the phenotype of malignant cells and to a certain extent reverse, at least in part, the phenotype of leukemic cells. And this is a picture of Leo in a meeting organized by Laurent de Gauss, and you can see that Leo is considerably taller than I am, and also that I look considerably younger at the time. And then this model was extended to viral-induced cancer, and of course I'd like to remind you that in those days everyone believed that all cancers were due to viral infections. And retroviral transformed cell lines, such as the FRIEND models, were shown by Charlotte Friend and her co-workers to be able to undergo differentiation in response to agents like DMSO. And a couple of years later again, it was the introduction of a hormone, retinoic acid, which turned out to be extremely important for the rest of the progression of the field, showing that retinoic acid had the ability to differentiate some myeloid cells, myeloid leukemia cells, either cell lines or even primary patient samples. And this, of course, was the beginning of the APL history, which I'm sure Laurent will review in detail, in which the terminal differentiation was shown to be achievable by retinoic acid ex vivo, to be linked to chromosomal translocation, and work that again Laurent will review of himself and Wang Zhenghe showed that this could lead actually to clinical benefit. This was not only differentiation in a test tube, this was differentiation in patient, yielding short-lived, at least, clinical remissions. And then there was the introduction of arsenic trioxide, which was really screened almost in patients, and that also led to the discovery that this agent in vivo, although not ex vivo, was able to differentiate leukemia cells and also to yield complete remission, but in contrast to retinoic acid, for which remissions were short-lived, here remissions were prolonged and actually led to disease eradication. And this, in the end, led to the eradication of the disease in virtually all patients by the combination of retinoic acid and arsenic. So is it a miracle or is it a model? I think this is one of the themes that we will discuss today. And just I finished using 2 slides that will be discussed by other speakers, some with the current inhibitors of IDH mutant enzymes, which do yield some differentiation in vivo and yield clinical benefit, although very rarely disease eradication, and also in the solid tumor model, in which interference with hedgehog signaling leads to in vivo differentiation and regression, and methods to transform this initial response into longer remissions have been recently proposed, and I'm sure will be discussed. So without any further delay, I'll leave the floor to Laurent de Gauss for his talk on the historical aspects of differentiation therapy.